Welcome to another episode of Hi, I'm Doctor. And today we have a special guest, a guest that motivates me to be a better person. We have Dr. Sanj Mohanta. And I think if I was going to summarize Sanj, I would say she really leads a life of we, not me. And I hope that makes sense. But she's always thinking of the people around her before she's thinking about herself. And she's always thinking about how to take our profession to the next level and always lend a helping hand. And you're just such a kind person. And I'm so happy to welcome you to our show. How are you, Sanj?
Oh, I'm doing great. Thank you for that great introduction, Nikki. And it's great to meet you, Akil. Thanks for inviting me to your podcast.
Yeah,
Likewise.
we're just so happy to have you here. We always start out by, we want to hear an introduction. We want to know about you. Why dentistry? Where'd you go to school? Where are you at now? Fill us in, Sanj.
Okay, so in light of the name of the podcast, hi, my name is Dr. Sanj. I'm a general dentist. I was born in Toronto. I grew up in Brampton, Ontario, Canada, and that's where I practice today. I'm so honored to treat children all day, every day. I absolutely love it. I work in public health. So all of my patients are on a government children's dental program in Ontario. And I went to the University of Toronto, graduated in 1999, and I absolutely hated my experience. It was like a last minute decision to get into dental school. I just applied because I originally wanted to go into research and do my master's and PhD. And then when I started doing research, I absolutely hated it. So the only thing left was dental school. So I applied last minute, got in, didn't enjoy my experience. It just felt off for me. And when I graduated, I also didn't enjoy associating. It just didn't feel right for me. And when my son was around 4 years old and my daughter was 3, I was on my way to my associateship position. And my son said, "Mommy, where are you going?" And I said, "Going to work." And he's like, "Why are you going to work?" And I said, "To make money." And he said, "Is money more important than us?" And that's when I
Whoa.
was like, "Oh
Ooh.
my
Deep.
gosh." Yeah, I know. That's that's when I thought, okay, what is it? Like, I'm obviously not enjoying my job. My kids can see it. So what is it that I really enjoyed in dental school? And I remember going to the public dental clinics and I loved working on the kids there. Most of them were new to Canada. It was their first time seeing a dentist. And I just loved how involved the parents were in trying to make sure that their kids' oral health was improving. And I thought that's what I should do, go into public health. And it also fit into my values because in high school, I was, in every club, volunteering every single day. I was advocating, I was writing letters to try to get Nelson Mandela freed from prison in South Africa. Like that's
What?
the type of kid I
Nice.
was. Yeah.
Lighthearted,
Yeah.
some call it.
I know. In undergrad, I was trying to get the University of Waterloo to stop doing experiments on rats.
Really?
Yeah, like I was always like fighting for the underdog. And so
Wow.
I thought public health. And so I got into public health and I've never left. And that also helped me get into other aspects of dentistry that I loved when I started thinking about what my values are. So I got into organized dentistry. So I volunteer with the Canadian Dental Association. I'm on their advocacy committee. With the Ontario Dental Association, I'm the chair of their community services committee. I'm the past president of the Halton Field Dental Association. I was the chair of the board for Gift from the Heart. Now I'm on the board for Filling the Gap, which is a dental charity. I also founded the New Dentist Study Club, and I also speak and I write articles. So,
Man,
that,
Sanj, you're just a badass. I just love it, man. You're just
but
a badass.
but even though I said all that, sounds really good. I just want to share a story with you. So a few years ago, I was mentoring a young dentist, female dentist, and she said she just came back from the Women in Dentist Symposium. And she said, "Sanj, the whole thing just made me feel really bad. Like I saw these women who had the perfect families and the perfect marriages and the successful practices, and they're speaking all over the world. And it just made me feel so bad because I'm never going to get there." And then I told her, I said, "Look, there are a whole bunch of different paths. Some paths lead to mountains, Some paths lead to meadows, but they're all beautiful. So like, don't look at me and think, wow, look at all the stuff I'm doing. I'm just following my values, and that's what everyone has to do.
For sure.
Yeah,
And I
like
think
we're all following our own path. No,
Yeah,
I
that's
love that.
right.
that's sort of the, you know, objective of the podcast is, you know, get through all those mountains and valleys and you know, learn how to draw like zip lines from them, right? Like jump
Yeah.
from, you know, Neki always says life's a string of pearls. And, you know, if you can't really learn from all those experiences, then you're really not doing them right. But there's one aspect of that very long story I wanted you know, drill in on. And no pun intended, drill down on.
I was gonna say something.
And and that was your experience in dental school. As you know, I'm in
Yes.
dental school. We share the same alma mater, but
Hmm.
what about it in particular bothered you or didn't
Yeah.
sit right with you?
Yeah, that's a great question. Well, the main thing was the way we were treated. The instructors were very intimidating. It wasn't a supportive environment. So, I hope it's much better for you now, but back then, they would yell at us in front of patients. They would say things like, "You idiot, what the hell are you doing?" Yeah, it
Whoa.
was really bad. And
Yikes.
yeah, exactly. So that's probably why I carried that negative feeling about, like, I lost my passion, not just in dentistry, but in life. I carried that through to my early years of associateships. It was a very dark time for me. Like, I thought about quitting dentistry. There were many times where I wanted to drop out of dental school. So,
So I
yeah.
can only imagine, what that kind of feels like. But Sanj, from the person I know of you, you always want to take a horrible situation and make it better. Like, have you
Mhm.
ever considered going back and teaching?
Yeah, that's I think that would be very therapeutic if I did that. It actually took me 15 years to set foot through the doors of U of T again. Like,
Really?
yes, it was like post-traumatic stress disorder. There are some of my classmates who have never stepped foot through the doors again, and they never will. I remember when my kids were young, I wanted to take a course in oral pathology, and the same course was being taught at U of T one week and at Western another week. And I thought, I can't go into that school again. So I drove 2 hours to London to go to Western and left my little kids at home with with my mom. So I'm like, that's how scary it was. And I was
Wow.
shaking 15 years later to go through those doors again.
So like being in the privileged position you are in now, you know, doing all these amazing things, publishing all the time, have you, you know, gone back and tried to change something or gone back and tried to, you know, speak up? Because, you know, it's tough to go through and it's tough to, you know, like you said, there's a lot of trauma from back then, but is it something you're following up in on now, or is it sort of just like, I don't want to be involved with this anymore?
Actually, no, it's good. I am shedding light on it. A couple of years ago, I wrote an article called "All I Need to Know I Learned After Dental School." And I talked about the horrible experience I had in dental school and how I rose above and found my path. And then um, I also wrote an article called DFFs, My Dental Friends Forever. It was focused on, the
Great
relationship
title.
I built with my classmates, because we became really close because we had to endure such a hard time together. But I also shed light on that as well. And then I spoke with the U of T alumni last year and said, we really need to do something for the new grads so that they don't have the same experiences that I did. And they weren't very supportive, and I
Hmm.
didn't expect anything differently from my experience there. So then I said, I'm going to do it myself. And I've started the New Dentist Study Club.
Yeah. And I want to talk to you about that. But like, how do you think we make this change? Like, I can't say I shared the same experience with you. I found, my professors were probably speaking crap about me behind my back because I felt like I had, like, left toes for hands. And and but they're probably talking shit about me behind my back. But like, how do you where does this change start? Like, where does this arrogance amongst dental school professors, that arrogance that we're not good enough yet, but then 4 years later we're best buddies? Like, where does that stop, and how do we create change? Like, what
Actually,
do you
yeah,
think?
I think it's already starting. We're seeing a lot of, the older instructors retiring. We're seeing a lot of new
Yeah.
instructors coming in. I know that there's a real focus on improving the student experience. Last year, the University of Toronto Faculty of Dentistry in the Alumni magazine, they actually wrote an article saying that they recognize that they didn't treat us well and they're trying to do better with the future students. So it was almost like a truth and reconciliation, but for dental students. So I like the fact that they're recognizing they are trying. It's a systemic problem. It's so hard to change even like one course in dental school.
Yeah,
So
it's just because you can't change old ways, right? Because
yeah,
everyone feels like that's the way that works, but really
it's
that does
true.
not work. What I found was really helpful is I would, I didn't want to go back to school and teach. I lived 3 hours away from my school. What I started doing is I started taking dental students with me to Guatemala or Nicaragua,
Mm.
and I had them for a week, and I could like indoctrinate them with the way dentistry should be, not just, the way that they're taught in school. And I know you are like, people say, Neki, you volunteer. And I'm like, no, I don't volunteer like Sanj volunteers. Sanj, you are my inspiration at wanting to be a better person by giving back as much as I can. Can you tell us how you got into volunteer dentistry and where that has taken you?
Yeah, actually, I would probably say, when I was in that dark place and thinking about what I should do to align with my values, I remembered in high school, I was volunteering everywhere and how much I loved it because I loved helping others. And I also loved meeting other people. And so then in dentistry, with my own local dental association, I started free dental days where we'd go into people's dental offices. All the other dentists around would volunteer, and I'd only advertise the event through food banks and shelters. So we knew that the people were in need. And also with Filling the Gap, which is a dental charity. There are 2 locations in Toronto where we open our doors and we see non-insured adults for free. And, there, I also went to Northern Ontario for 2 weeks a few months ago and worked in an Indigenous community. I absolutely loved that. So there are lots of opportunities to volunteer. And the other thing is you don't actually have to be part of a charity or a board to volunteer. You can do little things every single day, like accept patients on public dental programs, do some pro bono work for someone in need, and or even do things that affect, the barriers to dental care. Like there's some people who can't even afford fresh food and that's affecting their oral health. So volunteering at a food bank. So during COVID, I would, people couldn't get to the food bank. So I went to the food bank and grabbed the food and went to people's homes and dropped it off. Like 2 weeks after the pandemic hit, like I started a PPE drive. We went to my friend's office and all the local dentists dropped off, their PPE. Like it's little things like that. Like even during a pandemic, you can do something. During the pandemic, I was doing free dental screenings outside food banks because we couldn't do our free dental days.
Wow.
Like you can find opportunities everywhere and it doesn't cost a lot of money.
Wow. Have you ever given volunteering? I've done a fair share of volunteering myself. I've gone to Costa Rica to build a road, and obviously volunteerism has had this, whole new negative spin on it recently. But have you ever given volunteering, from more of like an introspective angle? Have you ever given it a look as to, do you find it helps you? Like, do you do it because it makes you feel better? Do you just enjoy giving? What are your personal motives to volunteer?
My personal motives is, well, a couple of my values are making a difference and connection. So I find that with volunteering, you're connecting a lot of people together that they would never meet. For example, we had a free dental day a couple of weeks ago, and there were displaced Ukrainians that came and,
Wow.
refugees from Afghanistan. So I would have never met them. And also the volunteers, we would have never met each other if we didn't have that free dental day. And then we made a difference because, these are new people to Canada. They needed help, can't afford it. And they were so grateful. Like the gratitude during a free dental day is like unbelievable. And so it just makes you feel so good because like, look what we can do with our hands. Like we can provide dentistry, but we can also hold someone's hands, like making them feel welcome in Canada.
Oh man, I was going to talk about that. That's like one of my favorite articles that you wrote.
Oh.
We'll talk about that. We'll talk about I wanted to pick your brain about something though, because like you do a lot of these free dental days, you see the need that's out there. You're working with people, like you're the hands on the ground, and the politicians are up in the House of Commons trying to dictate what we should be doing when you're actually doing what we should be doing.
Yes.
And so I you know what, I applaud you, and I'm just so proud that people like you are in our profession. I don't want to put you on the spot, but I know you do a lot of organized dentistry, and you know a lot more info than the rest of us do. What do you feel about the new Canadian government programs to help dental care?
I love it. I love the fact that everyone's talking about dental care. Finally, people realize that not everyone can afford dental care, and we're decreasing the financial barrier by this new federal government program. I love the interim program because there because it's only $650, so it's not going to, cost a lot for the government. There's checks and balances to make sure that people really do need it and qualify. And also dentists can do the work without doing any of the administrative work, and also getting their full fees, which they deserve for their services. So
I totally agree, because I personally thought when it first came out that they were going to dictate our fee guides, and that was going to be a mess across the country because every province has different fee guides. And then I was thinking, are they going to open up more public health clinics that people without, benefits could go to? How is that going to work with you have partial insurance? I thought it was going to be a massive mess. And, it's still maybe, I don't know. But I thought this is a good compromise.
yeah, I think so
Yeah.
too. And it's so important for all dentists to speak to their local MPs, MPPs, politicians, because do you know how this whole federal dental program started? When Jagmeet Singh was my MPP, I used to go to his office like a few times a year. He even came to my office and sat in my dental chair, and he got so sick of me talking about the need for increased public dental programs, and he would be like, yeah, yeah, I know what you're going to talk about. Don't even say it. And I thought he didn't care. And then when he became federal leader of the NDP, what is he talking about? Didn't care.
Yeah.
The
So
king
they're
of TikTok
listening.
himself.
I was telling Nikhil before we even started, Sanj is the reason why people are getting dental help now. So this is why I wanted to bring you on, because I think you're the celebrity behind this all. But
Thank you.
So not to play devil's advocate too much, right? Because I've taken a pretty deep dive into the health benefit. Where do you think that, it's called the Canadian Health Benefit?
Right now, the interim program is CDB, Canada Dental Benefit.
Canada Dental Benefit. So just judging by the name, I don't think it's going to stay in just peds, right? It's going to move to a much broader and much more inclusive program. How do you think, as it expands, it'll grow? Do you think it'll still be allow dentists to charge their customary fees? Do you think it's going to follow a same sort of structure as Ontario Smiles, I think it's called, or Healthy Smiles, sorry.
Ontario. Yeah.
Healthy Smiles, which doesn't have the best rep. So
Mhm.
how do you think this is going to grow, and how do you think they're going to scale it?
I think when it's finalized in 2025, that'll be similar to NIHB, which is the non-insured health benefits plan for Indigenous, because there's already a program out there. The fees are about 90% of the fee guide, which isn't bad. And, we don't get a lot of criticism about that program. So I think that since it's already there, that's what they'll use.
Interesting. Fascinating.
yeah, I don't know. I think this, just speaking off the cuff here, I can't say I'm as educated on this subject as Sanj you are, but I think this program would work better than NIHB, because this is a universal acceptance amongst dentists, because you've taken dentists right out of it. You've just let the government in charge, where you file a form on your tax return and you get that money with that dental receipt. I think there will be much less pushback from dentistry by keeping it this way. I don't know if going to the NIHB route would be as well accepted. What do you think?
Yeah, I would love it if it stayed this way. It's just financially, I don't think they can support
No.
this. And and
Yeah,
also, right now it is possible for parents to get the $650
it
and
is.
not use it for dental care
Right.
Yeah.
and just hope that they don't get audited.
Because
Yeah,
they get it proactively, right?
yeah, they
Yes, you
do.
do.
Yeah. And you know what this reminds me of? COVID, when everyone
Yes.
got $2,000
Yes.
every month for watching Netflix. And then 2 years later, every single one of my staff gets a letter saying, nah, nah, I want my 6 grand back. And they're like, what the hell? I wasn't working. And I'm scared that that's going to happen here, man. Those Netflix bucks sure are being paid back now. So that was rough.
So
But right
is
now
the
it's good.
does the NIHB, because I'm not familiar with it,
Mhm.
does it, follow a same sort of structure as Canada Dental Benefit, or is it do you directly bill the government? How does that
You
work?
directly bill the government.
Okay.
Yes. And then they restrict they have a fee schedule. So there are only certain procedures you can do. But right now with the CDB, you can use it on anything. You can even use it for orthodontic treatment.
Right. Interesting.
Wow. I feel like I know Akil, you've done some previous episodes on it. So, let's guide the listener down to there. But Sanj, I really want to talk to you about something that I find was super awesome and you just did. I wanted to congratulate you on your most recent article in the Globe and Mail. And I remember
Uh,
the second I saw that, I read it and I called you right away because I used to go grab the Globe and Mail back when you can get physical newspapers. I don't know if those even exist anymore,
they do.
but I used to go to Starbucks every Sunday morning and buy like the $3 newspaper that was like this thick, right?
Oh man.
And I just sit down with a cup of coffee and go through it. And I always loved reading the editorials, that first person, like where you wrote
Yeah.
your article. And your article was it hit home to Akil and I, because we're both brown dudes growing up in a white world, right? And your
Coconuts.
article, yeah, coconuts, right? Your article was called "Talking About Where We Came From United Us More Than Talking About Our Pets."
Yeah.
Um, just tell our audience about the article and why
Yeah.
it resonates with us brown people.
Yeah, it resonated with everyone, all
Yeah.
Canadians. So I wrote that article when I was up north in Northern Ontario, and I was just thinking about, people's identities. And one of my friends told me that he experienced discrimination when he talks about his identity. And I thought, that is so unfair. We should all be talking about where we're from. And so I actually like it when people ask me where I'm from. And I found that, lately people are nervous to ask people about, oh, your name's different. What does that mean? Or where are you from? Because they don't want people to feel like they don't belong here or that they're foreigners. But I love it because then it actually, like my name means, it unites us, because then we can start talking about commonalities, differences. It makes us realize how unique we are. And then it makes you feel proud of your identity instead of hiding it. So I loved how so many people related to it, and they would say things like, I remember my lunches, my smelly lunches, or they would say things like, yeah, like people don't know how to pronounce my name. And it just it was so many people emailed me and messaged me after that telling me what their name means.
Man, I love it. But you know what I first thought of the second I read your article? When I was a brand new dentist, I live in a rural Albertan town, and this is home for me. Like, I love it here. Everyone treats me so well. But I had this older patient. She looks up at me, doing her checkup for the first time, and she says, did you have McDonald's where you came from? And I look down at her and I'm like, Calgary? Yeah, we had McDonald's in Calgary. And it just made me think of that moment. And I never thought about that moment for years, but it made me think of that moment because we all come from different backgrounds, but we are all united here in Canada. And maybe I was a bit of a dick for saying Calgary, but I just wanted to drive home the point that, like, I'm as Canadian as you are. Like, I was
Yeah.
born here too, and your story really resonated with me because when I was growing up, I didn't want to go to school and, like, have my dad make my lunches, and maybe our food smells a little different.
Yeah.
But yeah, but now as a 38-year-old dude, I'm like, hell yeah, dad. Like the second you want to come here and visit me, I'll take all that to work and I'll feed everyone. And we become more proud of our cultures. So I
Yeah.
wanted to just congratulate you for
Oh, thank
I
you.
just loved it.
Yeah, and when people
Yeah,
ask where you're from, they're not trying to be cruel. They're trying to be
no,
curious. So just,
yeah.
yeah, start a conversation.
But what's funny is, I don't know, maybe you guys can chime in here. Does your answer change if it's a friend asking you where you're from or if you're in the back of a taxi? Because I find when, when I'm in I mean this genuinely. It's like now it's like, I'm in a taxi or I'm in an Uber and the guy that's driving it, maybe South Asian or Middle Eastern, and he goes, "Where are you from?" And like, I was born and brought up in Mississauga, right? So it's like that's not the question he was asking, right?
That's right.
Yeah,
He's asking, "Where are you from?" Right? And you touch on that on the article a little bit.
yeah,
It's like
it's true.
it's not really like, it's such a context dependent question.
Yeah, it's true. But I tell everyone the same thing. It doesn't matter who asks me.
You tell everyone the same
Yeah,
thing.
yeah, I'm honest. I know they don't want to hear Mississauga.
Yeah, 100%,
Yeah, they want to
100%.
hear the exotic
Yeah,
answer,
they want to
right?
hear what part of India I'm from, not what part of Mississauga I'm from.
Well,
Like, do you think that they want to hear like some sort of exaggeration though? Like, yeah, we grew up in these small mountaintop villages where blah blah blah. Like, do you think that's the answer that people are looking for,
I
just
think
to
they're looking,
create the
some people
story?
are looking for something exotic, but I do bore them when I say, but I was just born here in North York and my parents are from India. I haven't been there in a while. Like they do get bored that way, but then that's when we can start talking about our pets. And at least it opens up the conversation.
Totally.
So I'll tell you an interaction I had, I kid you not, probably 3 hours ago. I was leaving the school, and my girlfriend was speaking to one of her classmates who's an IDAP student. You're familiar with IDAP, right?
Yes.
No,
So
what's IDAP? What's IDAP?
it's basically actually, Sandra, you're probably better
Yeah.
suited to talk about this.
So it's a program that allows internationally trained dentists to become
Oh, yeah.
licensed in Canada. So what they do is they do their third and fourth year with the dental students.
Okay.
So my girlfriend was talking to Ella was talking to an IDAP student, and this IDAP student, I had to go change the change room. I come back out and we're ready to go. And I start talking to her and she goes, "Where are you from?" Right? I kid you not, this happened a couple hours ago. And I go, "India," and she says, and I ask her, I said, "Where are you from?" And she goes, "Pakistan." And I said, "Oh, like what part? Lahore or any other place?" And she like for a second was like, "Whoa, like you actually know Pakistan?" And I'm like, "Yeah, my grandma was born in Lahore, right? When it was like all India at one point." And it found it to be such a bonding moment,
Mhm.
when you just kind of, it shows that you have some interest or you have some sort of at least knowledge of the place. What in your kind of practice and in your professional life have you sort of, or when have you seen that kind of to be true?
About opening up the conversation.
Yeah, like opening up the conversation when it comes to where people are from or personal details, because I think there's that idea of clinical dissonance, right, where you kind of want to be like a
Yeah.
little bit retracted from the conversation, but you seem to like to go deep, right,
Yeah, I
like to learn
do.
about
I'm
people.
a
So tell us a story or two about when you've done that.
Yeah, like there was actually one story where when I was asking the lady where she's from, I noticed that she had burn marks on her arm. And, we first connected because she said she's also from India. We were asking each other what parts. And then I said, "Where are those burn marks from?" And then she said that, there was someone who was angry against the family. So they burnt the whole house down. And she was the only one who survived. And she was a child. And she has these burn marks left over. And I started bawling. I had to leave the room. I couldn't believe she went through that and she was a survivor and she was like saying it with such strength. So she wouldn't be able to open up to me if we didn't have that initial conversation about where we're from. She probably would have just said, "Yeah, I was in a house fire, I got burned." And I find that with patients, they like to see that you understand them. Like it's part of the patient experience, it's part of building trust. They want to see that, okay, you get me.
I find it so, I totally hear what you're saying.
Yeah.
I just find it so interesting that we see mouths and sometimes we just focus on the mouth and you don't always remember that there's an entire life story behind that mouth, that they've come to see us for. And it's we take that for granted a lot, and we know that there's a lot of trauma and a lot of pain behind those teeth. And I hear you, Sanj. Like, it's so awesome to just take a couple minutes and just learn where these people, where our patients come from, and the history that they've had. And you'll be shocked at how easy it is for them to share stories with you.
Yeah, they want to connect with you. They're
They
scared
do.
when they go to the dentist. So
Yeah.
they're looking at any sort of connection at all. So all of a sudden you'll see that their shoulders will drop. You start laughing with each other, and
Oh,
they'll start
totally.
talking about where they've traveled to. They'll say, oh, things like, oh, my neighbor's also from there. And all of a sudden, like, it doesn't feel like they're being treated by a dentist. It feels like they're being treated by a friend. So it
Totally.
feels like a conversation at a coffee shop rather than a dental
Than
appointment.
the dental office. Yeah. I think you spoke about this in my favorite oral health article that you've written. And I don't want to mess up this line, because I absolutely love it. And it's this, like, as dentists, we learn to do so much with our hands, but sometimes the best way we can heal with our hands is to hold someone else's. And
Yeah.
I feel like you do that. And it's just so powerful. Like, every time I read that, my little arm hairs start like, yeah. And so,
Yeah.
like, how did you learn to write this way? How did you learn to get these emotions out on paper? Tell us about that. Because
Yeah,
you write every month, man. This is
yeah,
awesome.
true. Yeah, so when I was younger, I actually was really bad at English. It was my worst subject. And your teacher always said things like, okay, write an article, make sure someone reads it. Write this essay, make sure someone reads it before you hand it in. And I was so ashamed of my work that I never asked anyone to read it, proofread it. I would just hand it in. I'd get a bad mark. I wouldn't even look through it again. I would just shove it away. I didn't enjoy writing because it just felt so vulnerable.
Hmm.
And it wasn't until the pandemic when I did a virtual seminar for pre-dental students. And I actually started talking to them about things like, hey, I failed a course in first year dental school, and, I was held back in pre-clinic. And I noticed that all of a sudden they're like, really? And all these people were messaging me afterwards saying things like, I thought I was the only one who failed. I didn't think I'd be able to get into dental school because I failed something, but you got in. And I just felt like it really struck a nerve. So that's when I started writing from my heart. And I told you, we were talking on the phone before, like, writing is like being naked. Like, you have to show
Totally.
all your emotions to really hit the audience. Like that article about holding someone's hand. I was worried about having that article published because I admitted that I extracted the upper left canine when it shouldn't have been extracted. And I thought the college can, or the patient can make a complaint, the
Totally. Yeah.
college could make an investigation. But I thought, well, that's actually what I did. And I deserve to be punished if they think I should be punished. And other people can learn from my mistakes. So that's why I wrote that article. It was actually therapeutic because I was really struggling with the fact that I extracted that tooth when I shouldn't. So I thought the best way I can heal from that is to write this article so that other people can learn from it.
Yeah. Like, your vulnerability is just, you throw it all out there. And I think that's how you're able to connect. And I just love it, Sanj. You keep up the great work, eh?
Oh, thank you.
When you're writing an article, like you talked about this like feeling of being naked. Just before hitting record, I was telling Neki, I was like, yeah, like, we're talking about oral health. I'm like, yeah, like, I published something in first year, and like it wasn't my best work at all, but it was just, like, it was so nerve-wracking. And I was like, oh my God, like, number one, I'm dyslexic. So like, in no world should I be writing anything, let alone something in a magazine that like people way smarter than me are reading. And then two, I'm like, I wrote it on mental health. I'm not a therapist. I'm not a psychologist. I have no authority to speak on this issue other than like my experiences firsthand. So it's like, speaking to little me when I was in first year writing this article, I had a ton of help writing it, but Speaking to me, what would you tell me back then? The sort of nervous first year, not thinking that they're good enough to write in, one of the best and one of the most widely read magazines out there in
Yeah,
dentistry.
I would tell you and anyone else, if you're passionate about writing something, just write it from the heart. And if you write it from your own personal standpoint, no one's going to say things like, well, that's against the research and the evidence and this latest scientific article. No one's going to say that because it's being written from you. It's your heart, it's your experience. And to write it in one sitting and don't go back and change anything. Because the first time you write something,
Ooh,
yeah, I never go back. I, that Globe article I wrote in an hour and a half and just press send.
really?
Yeah.
And it just gets published just like
Yeah,
that.
it's true.
Oh
Because all of
man.
a sudden you start overthinking.
Yeah.
I think the problem with a lot of us and why we can't find our values is that we're overthinking. And like I always go back to, okay, what did 10-year-old Sanj like to do? And then I'm like, well, that's what I should be doing now because that's when I had no expectations on me and no responsibilities.
When you
So
say you just wrote this article and in an hour and a half and hit send, like,
yeah.
what does that mean? Who'd you send it to? Like, did you send it to
Yeah.
info at the Globe and Mail? Like,
No,
can I do
so
that?
yeah, so if anyone wants to write for the Globe and Mail, what you can do is it's called first person essays. And it has to be around 900 words. It has to be your personal story. It can't be anything political and just submit it. And if they like it, they'll publish it in 1 to 2 months. And that was the first time I submitted anything to them and it got published and I got a lot of Globe readers wrote in and said that they really liked the article. So I was really happy with it. So if I could do it, anyone else can do
Uh, that-
it.
I love that. That's so awesome. But like, I know you don't only do, a lot of writing. Actually, the first time I met you, we were both public speaking, and we met at PDC. Do you remember COVID PDC? That's
Yes,
how I like to call it.
I know.
The year of PDC where we all had to quarantine after, and we didn't know if we got COVID at the same time. That was the year of COVID PDC, and we sat beside each other at lunch, and I'm like,
Yes.
"Who's this friendly person?" And I felt like you've been my homegirl since.
Yeah, I feel
And
the same way.
yeah, like, how did you get into speaking? Because I know you talk about everything from, I saw you doing a presentation on medical emergencies, oral cancer screenings, patient communication. Like, you're all over the map here. How do you get all these gigs? But how did you
Yeah.
get into public speaking?
Okay, so I taught at a dental hygiene school for 8 years. So I taught theoretical courses and clinical courses. And then afterwards, the Dental Hygiene Association asked me to speak. So that's how I got into it. But those were just like small scale things. But I'm going to tell you how like I got into these bigger speaking gigs. I was at the Ontario Dental Association annual spring meeting a few years ago. And I was at a lecture and I hated it. I remember thinking to myself, I could do a better job talking than they can. So I went to the exhibit hall and to the Johnson & Johnson booth, and I just started asking questions about like, what's your latest project in for Listerine? So it was just like a normal conversation you'd have with an exhibitor. And then she's like, are you a speaker? And I said, no. She's like, you should be. You're really knowledgeable and you have a great personality. And I'm like, really? And then all of a sudden she signed me up to be a KOL, a key opinion leader.
Yeah.
And then, flown to Kelowna for a presentation, flown to Montreal, flown to Vancouver Island. Like it was just going up to an exhibit booth. And then Pacific Dental Conference 2020, they have something called So You Think You Can Speak series. And I just applied and I got in.
Wow.
So awesome.
All I could think of is Neki being like at the PDC COVID conference, who's this friendly person? And then give each other COVID. So
Yep.
not so friendly anymore.
That was
But
crazy.
you seem like such a go-getter, right? It's like you just like submit something in a Globe and Mail. You just, go to you said Johnson & Johnson?
Yeah.
Yeah, you just go to the Johnson & Johnson booth and like go pick their brains. Is this something you always had? Were you always just a super ambitious go-getting girl, or was this something you
Yeah.
developed over time?
I think first of all, I like connecting with people. I like talking to people. So when you talk to people, all of a sudden they're like, wow, you're kind of interesting. Let's see what we can do together. And then all of a sudden, like you get all these opportunities.
Wow. making Neki and I nervous. We have a
Yeah,
rival.
what are we doing?
She's the Globe and Mail. She gets published every month.
I know, man.
Yeah, I'm gonna start a podcast too.
We squash in no time.
You might as well. Can we work for you?
Do you want to come
We'll
on
write
here?
your
We can use a
questions
third.
So Sanj, like you do a lot of public speaking. I try to talk, every once in a while, but like I still get nervous when I speak. I don't know about
Yeah.
you. This was so embarrassing, Sanj. I was getting some award, and it was like 500 people there. And they're like, they're talking about the award, and I didn't know I was gonna get it. And I just started sweating, like not wearing a jacket, just like a shirt, but it was like a gray shirt. We all know, all my
the
guys
sweat
out there.
stains.
Yeah, if you start
Yeah.
sweating on a gray shirt, it turns black, and you see it, and you can't run away from it. And then you look under, and it's you can see, and then it just makes you sweat more. And then they're talking about this, and then you just start sweating more. And I'm not even joking. I had this pit stain from the tip of my armpit down to my waist. I'm not kidding. I know it's disgusting, but whatever. I'm real, right? And I just get so nervous, and I started to sweat. And then, that was like my thing. After every presentation, I have to get called up to. I just start sweating. How do you? Thank God I'm not that bad anymore. But like, how do you deal with these nerves? Like, what do you do when you're public speaking and you're nervous? Like, what's your go-to to get out of your head?
Yeah, I used to be a horrible public speaker in high school. When I did presentations, I used to be the person where the words wouldn't even come out. And then how I calm my nerves is I'm not doing it for the audience. I'm doing it for myself.
Yes.
So I'm just like,
That's what I say now too.
I'm just going to be up here, and I'm going to entertain myself. I'm going to laugh at my own jokes. And as long as I'm having fun, the audience is going to have fun.
Yeah.
So
That's my
that's how I
coping
do
mechanism
it.
too. Oh,
And then I
Yeah.
recently joined Toastmasters, which is a public speaking group. And it's like very competitive, where you're, try to like win awards at each lecture. And so that really teaches you like the techniques of public speaking.
Neki, I gotta ask,
Yo.
from one sweaty brown guy to another. When you sweat, do you just sweat from the armpits, or is the face, the legs,
No.
the body?
The feet.
It's everywhere.
Armpit, man. Armpit only. Armpit only.
Only armpit.
Only. I remember I was joking around with my doctor, and I live in a small town, so you know everyone, like your doctor you hang out with, right? And I was like, man, I was telling him the story, like, man, whenever I go public speak, I sweat. And he's like, you can get Botox for that, right? And I'm like, Botox in your armpits? And he was like, yeah. But I'm like, yeah, but it's gonna go somewhere. Then it's gonna be like all over my face. I think that's even worse, man. That's like when you go eat, you go eat pho, and you're with your friends, and it's hot soup, and you just start sweating. Like, I don't want that. That's even worse, man. So, I'm happy.
You're
it's just-
describing the exact issue I've had. So I got this, Sanj, I'm sorry. This is disgusting, and this is not what you came on the pod for, but I had the same issue, excessive sweating. I bought this thing called Dry Cell. Okay.
Yeah,
It's
I've
called
heard of
Dry
that.
Cell.
I saw that, yeah.
I put it on, and then all of a sudden, I'm like walking to school, and then my back is just soaked, or my face is just soaked. And I'm like, what is going on? Right. And I never made the connection for weeks and weeks and weeks. I never made the connection. I'm like, oh, if it's not coming out of one pore, it's going to come out of the
Gonna go
rest.
somewhere, yeah.
So, but it was an interesting conversation I had with my therapist, because I'm like, why do I sweat? Like, is it that I care that people, is it I'm scared I'm going to choke? Is it scared that I care what people think about me? What is it? And he tells me like a really vulnerable personal story. He said, you know what, man, I'm a therapist. Shout out to Ellis, best therapist in the world. Ellis, he's like, when I started my career, I would go, he's a white dude. He's like, I would go red when people would tell me something embarrassing. And he's like, as a therapist, there's no worst possible thing you can do when someone's like being vulnerable to you. They're like crying. They're like, telling their like personal stories.
Red.
And then he turns red. And I'm like, wow, like that sounds way worse than the sweat, right?
Yeah.
And he's like, all I had to do was say, okay, he said, you sweat. And I said, yeah. He's like, so? And I'm like, well, it makes it look like I'm nervous. And he goes, so? And I'm like, well, it makes me look like I'm not confident. And he's like, so? And I was like, what? He just kept going down this path of like, so what? And at the end of the path, I was like, so like, I guess I don't really care, because who wouldn't be nervous giving a speech in front of 500 people? Who wouldn't be nervous, talking to people about their most innermost vulnerable conversations.
Mhm.
Who wouldn't be nervous, networking at an event that, like, you don't know anyone and you're the dumbest person in the room. So at a certain point, you just kind of got to be like, like, it is what it is. That
Yeah,
was
that's
my tangent.
great. No, it's good.
That was my one
Because like
tangent.
because public speaking is like a really scary thing. So that you're nervous, but the audience is looking at you going, "Oh man, I'm glad it's you and not me up there." Yeah, so don't worry.
But no one says it. No one says that.
Oh,
You
they're
know,
thinking it.
it's at the point now though, Sanj, like, I don't know about you, but I quite enjoy it now. And like Akil and I, we were just in Montreal, and we I got to public speak, and I find it's just the easiest way to connect with people now, because
Yeah.
you have their attention, you can self-deprecate a little bit, you can get on the same level, and it's fun. But I can see how newer dentists, like even talking to patients, can be quite, anxiety ridden, because they don't really teach communication in school.
Yeah.
No matter how important people skills are, they're so focused on the angles of your boxes, of your
Mhm.
proximal boxes, or whatever, man. Like, it's just irrelevant, and we really need to start talking to people more. Is this what you guys talk about in your, like, new dentist study club?
Yeah.
Like, what happens there?
Yeah. So with New Dentist Study Club, instead of like a lecture style discussion, for example, we have a meeting upcoming on pediatric dentistry. So what happened is the members emailed me the questions of like what they want to know, like how to give local to a kid who's crying. And then I'll send those questions to the speaker. And then when she talks, like her whole presentation is geared to what the members asked beforehand.
That is a wicked
Yeah.
format. Like, that's
Yeah.
how all study clubs should be. That's how
It's
all
true.
lectures should be. I love that.
Exactly. Yeah, and then there's a lot of talking from the members. So instead of the the sage on the stage where someone just sits at the podium and speaks, the speaker is the guide on the side. So they're just there to
Ah,
facilitate. And it's actually like even new grads are the ones saying things like, "Hey, I do this, when I give local to a kid." So like everyone starts sharing their own ways of, how they do certain treatments. So we all learn from each other. And that's what adult education is about, peer to peer learning.
This is a bit of a stupid question.
Yeah.
But what is a study club exactly? I've never been to a
Yeah.
meeting. I don't know what they are. Can you
Yeah,
explain what one is?
study clubs are smaller than associations or societies because it's about 30 people. And so everyone feels comfortable talking, contributing, and you show cases and you say things like, "Okay, what would you do in this case? This is what I did," or "I just had this tough situation. What would you do?" So it's a lot more of a support group and case by case learning rather than lecture style scientific learning. So
like,
Interesting.
yeah.
like, Akil, do you guys in dental school, do you guys even know about this new dental study club in Toronto?
No, we don't. We don't even
Sanj,
know what study
how do
clubs
we
are.
get this out there, man? How do we get this? Because
Yeah.
this is what I wish I had. Like, you always, even, I'm 15 years out, I still wish I had a specialist brain to pick all the time. I'm like, oh,
Yeah.
I always wonder about this, or I always wonder about that. And you've developed such an awesome format that you allow, dentists to ask these questions from the experts.
Yeah.
Like, how do you, and also, this is how I think you are giving back to the generation that was so hurt from dentistry. This is
Yeah.
how you're recreating, or you're
Yeah, it's
reframing how
true.
dental schools should be. Like, this is phenomenal. I live across the country, and I'm flying in for one. Like, this is
Okay, good. You're on our speakers list for next year for
I
sure,
want to be a
Neki.
speaker. I
You
hope
want
you
to
bring
join
in
the club?
I want to bring a surgeon there and be like, what antibiotic do you get? No, but
Yeah, we're
like,
on Instagram at New Dentist Study Club if you want to find out more.
that's wicked. I love that. But Sanj, how can we get the word out to dental students? Because this is
Yeah.
wicked. Yeah.
Yeah, it's like I would love it, Akil, if because we're based in Toronto, if when you're in fourth year, if you tell your colleagues about this so that they can join after they graduate. And what I would love is because study clubs are meant to be small, is that people start this all over the country. We can have a new dentist study club, Lloydminster. We could have a new dentist study club, Winnipeg. So because like I've created this like format of how to have a new dentist study club. So people, it's like a recipe book. So people can just copy it and do it in their own city. I love it. I love this to be happening all over Canada.
I will 100% share the word or spread the
Oh,
word.
thank you.
But how do these study clubs typically come to be? Is it just one person that says, "Hey, we don't have enough dental community or enough dental support"?
Yeah,
here
a lot
to,
of them
you
will
know?
do that. A specialist will just start, for example, a specialist will start something for the dental hygienist, Ontario, for example. Or there are things like they're more established, like Seattle Study Club and Spears Education, where there's already this big group, and then they have little cities that will start their own clubs. And you just need like a couple of people in those cities to reach out to big players like Seattle Study Club and Spears and say, we want to start our own club here. And then they send you all the information.
Yeah,
Nice.
man, Sanj, I find it so hard to keep up with you. Like just when I think, I have a busy life, or I always have like irons in the fire everywhere around me. Like you're just showing me up, and you're showing me like but you're actually doing it. All my stuff is in my own head, right? Like you're always writing, you're teaching. I just think it's great. Sanj,
Oh, thank you.
how do you stay so positive? Because
Oh my
I find that to
gosh.
be tough.
Yeah, I'm a very positive person. I think that's my default mode, is to be happy. If I was a Care Bear, I'd be Cheer Bear. And and I think like the reason why I'm able to do so many things is I'm very disciplined. I'm very routined. Like I wake up early in the morning, walk my dog, go to work, walk my dog again, walk my dog for a third time. I have like I do things in a very efficient manner too. Like it doesn't take long for me to write articles or to
Yeah,
bring up
no
a
kidding. You get published
presentation.
after a 90 minutes article on your computer. That's amazing, man.
But that's because I'm very focused. And I think what's helped is I do meditation and I do yoga. So when I'm doing something, I don't think about anything else. Like I'm a very mindful person. When I brush my teeth, I'm not thinking about anything else except for brushing my teeth.
Wow.
And it's
How did
actually
how did
very
you get that
challenging
way?
to do that. Yeah, it took me years to figure out how to meditate. I used to go into the yoga class, just do the stretching part and leave at the end when you're supposed to meditate. And then I just forced myself, and it was brutal, like to force yourself to meditate, not to think about anything. But it's like a muscle. You have to practice it every day. And then when you get it, it's like, oh, it's
And
enlightenment for
are you
sure.
just listening to like the Calm app, or
No, I don't
what are
listen
you
to
doing?
anything at all. I just focus on my breathing.
Wow.
I'm 24 days into daily meditation, and it's probably
Good
one
for
of the
you.
greatest things I've done.
Yeah,
Whoa, whoa,
it's
whoa, homie, fill me in, man. What are you talking about? You're 2040. We don't talk about this one. What is that? What is daily meditation?
I told you in Montreal.
No,
I
no,
told
but you
you.
never told me more. But you just said you were meditating. I was like, okay, homie's meditating. All right.
No, it's honestly like, well, I think the example I always give is it just gives me, when you have like a knee jerk reaction and you're kind of like, I'm trying to think of how I can shorten this story. I'll just tell it. It's 2 seconds. There was someone that I knew that had just recently quit their job. I bought a coffee machine off them. Neki, we talked about this.
Yeah, yeah, yeah.
I bought a coffee machine off them. I'm Neki and I are both big, coffee heads. What's the right word for it? Coffee junkies or what
Yeah.
have you. But I just started meditating. This was probably like 3 or 4 days into meditating. So I was very new. I was all very fresh. I was very zen. I was floating all over the place. And, this guy, I text him, the coffee machine broke down. I text him, I'm like, hey, man, can you like help me out with this? Like, anyways, long story short, he kind of blows up on me. Right. And my knee jerk reaction is to kind of like dish it back a little bit. Right. It's like, well, like, you can't just blow up on me. Like, I'm like the customer, right? I'm the patient. You can't just like do that to me and not expect anything in return. But I was like, for 2 seconds, it gave me, for some reason that day, or the meditation just gives me like a 2 millisecond gap between when I receive information and when I send out information. And that 2 milliseconds just let me even postulate the, reality that, okay, maybe something bad happened in his life, right? Because you're always like, you want to give people the benefit of the doubt. Anyways, something bad did happen. He quit his job. He was frustrated at work. So he calls me probably an hour later and he goes, hey man, hey Keel, I'm so sorry about that. Like that was completely out of line, because my response to him when he kind of freaked out on me was, dude, I'm sorry, I didn't mean to offend you. And that just diffused the whole situation. He called me back,
Oh,
being like, hey, sorry, some really
Wow.
bad stuff happened in my life. I'm really struggling. Turns out we're buddies now. We're actually buddies. And
wow.
we talk about coffee all the time. We talk about grinders. We talk about not the app, the coffee grinder. We talk about everything, right? We talk about everything under the sun. And it's amazing because he's such a cool dude. And I'm like, had I not taken those 2 seconds to meditate, or 20
Yeah,
minutes to meditate, and had I not taken those 2 seconds to think of my response, it would have been such a different outcome. We probably would have been
Totally.
like enemies, right? I would have hated him.
yeah.
He would have hated me. And it just takes 2 seconds to think about 2 milliseconds about how you're going to respond. That's kind of what made all the difference. What have you found in your meditation journey?
Yeah, so I find that when I don't get angry as much, I work with kids every day, so you have to be extremely patient. So I found
Oof.
that yeah, that even
It's stressing me out
working,
just even thinking about that, man.
even working with kids, it's so fantastic because if they're crying and the parents are yelling at them to behave, like I'm the calm one in the room. And
Wow.
so then I just manage them just with my words, just by and then I read that if you're calm and you have a low heart rate, that actually the people around you mimic it. So because I'm calm, all of a sudden the kid will be calm, the parent will be calm, and then we can get through the appointment.
So are you
And
trying to say like the 80-20 on the nitrous doesn't always work?
I hardly ever use nitrous. Yeah, I treat my kids just by talking to them and being kind to them and using positive reinforcement. I never say anything negative to the kid. So instead of saying things like open, why can't you open more? If I catch them opening wide, I go, you are such a good boy. Thank you for opening so big. Oh, I love how you're keeping your hands on your belly. Oh, I can work so much faster when you're not moving. Like it's all positive reinforcement instead of saying things like stay still, got to get through this. Like
Does
so
that work for like 19-year-old teenager,
yes.
like,
When you're trying to
dude, I
take
got
out
one more
wisdom and
wisdom tooth
molars.
to pull. You're moving around all over the place. Work with me here, brother.
Would
Yeah,
you
just
say would you say meditation is a way you turn around a bad day?
oh
Because
yeah.
everyone has their bad days,
Ooh, yeah.
right?
Yeah, it's true. So, for example, if I'm upset, instead of being upset with someone, I'll think, oh, this person is teaching me patience. It's like the way you shift your mindset all the time, or, just taking a moment to breathe, like you said, before you react, and to always think the best of the other people. So if someone's just cut me off on the highway, instead of thinking that jerk, he was trying to cut me off, I'll think, oh, he just needs to get somewhere really fast. I wish him well.
You taught me that. You're like,
Yeah,
always think about what's going through someone else's mind. Don't, give your reaction, because
yeah,
we were talking on the phone about that.
yeah,
If someone cuts you off on the highway, they obviously have a place to go that's more important than where
yeah.
you're going to. And so just let them have it. And it was funny because we were in Jasper on the weekend and we were on the highway. It's a 5-hour drive. And this guy just totally cuts me off. And I'm just, in my zone listening to Jay Shetty, right? Sanj,
Oh,
listening to Jay
I
Shetty.
love
It's our
Jay Shetty.
man, you know what, Akil? You know what we need? Being cool brown dudes, we need British accents. That's what we need right now.
Like Jay
Yeah,
Shetty.
we do so much better.
We'd be so much cooler,
Your
man.
podcast would blow up like Jay Shetty's.
Yeah, so I'm gonna start
Instantly.
talking. We got to figure that out. But anyways, someone cuts me off, and it automatically, the first thing that enters in my mind is your voice, Sanj, saying, that dude has somewhere else to go. That's more important than you, or it's an emergency or whatever. So,
Yeah.
thank you for being
Oh.
my 2-second meditation.
Oh, you're
Um,
welcome.
yeah. But Sanj, like, you work in public health dentistry, just like you were saying, and you're working with kids all day. I think, after a while, no matter how, like, this meditative state you have, like, it's got to grind on you after a while. Kids are tough. Kids are really tough. How do you pump yourself up? Like, how do you show up to work every day, even when you're not having the best day?
Actually, when every single day when I show up to work, I have the smile on my face, like I get to work with kids all day. I get to play with kids all day. Like I have the best job that a dentist could have. absolutely love kids. So I think that's what makes it easier. They're so cute. Like even when they're crying, I think they're cute. So I'm definitely meant for kids, but I do
Yeah.
have bad days. And when I do have bad days, I do things like journaling, deep breathing, meditation, yoga. And the thing that works best for me is going out in nature, like going for a walk.
Going for a walk. Yeah.
Always. And when I go for a walk, instead of thinking about the bad situation I'm in, I'll just look at the trees and go, look at that beautiful leaf.
Yeah.
Look at that look at the flower on that weed. Like you just look at the beauty of everything and all of a sudden it's like, oh, what was bothering me is like look at the sunrise. Like that's so amazing.
Wow.
Yeah.
Well, I mean, I know we could talk about this all day. We could probably throw on a couple of British accents, go on even a little longer, maybe climb up the charts. But Sanj, it was absolutely phenomenal getting to know you. This is the first time you and I have spoken. You and
Yeah.
Neki kind of seem like you go way back to giving each other COVID. So,
Super spreader event.
but what an awesome episode. Really appreciate you taking the time to come on.
Yeah.
Oh, thank you so much. I'm so
kind.
honored that you invited me. Best of luck with the podcast and best of luck in dental school. And I can't wait to work side by side with you, Akil.
Awesome. Well, hopefully that day doesn't come where you're pulling my teeth or something.
And Neki, thanks so much for the invite.
No,
You're such a good friend.
Always motivating me.
I'm looking forward to seeing you at PDC 2023.
That's right. We're gonna redo the super spreader. This is just gonna be normal PDC. But we're gonna see each other for lunch at the exact same table.
Exactly, we will.
This time with tuberculosis. All right, everybody. So Neki man, how'd you think that went?
It was real, and I really like that, and that's what I love about Sanj is she's always just so positive, and she's always fighting for the underdog, exactly like she said. Like I really do think that the Canada dental benefit came partly from Sanj, because I remember stories she used to tell me, like she was trying to always talk to Jagmeet Singh about getting fluoride in the water and how important dental work is. And then you fast forward 10 years later, and what's he fighting for? So what do you think about that? Do you think, is it one of those situations that like the greasy or the squeaky wheel gets the grease type deal, or what do you think?
I have to be honest with you, never understood that. But sure, yeah. I think the squeaky grease gets the wheel.
Yeah.
I agree with you. I think just super authentic, not afraid to speak her mind. Appreciated that she recognized the sweater, which is thanks to you.
Oh yeah. Yeah.
Dude, available at highmdoctor.com.
Yeah.
No, I'm kidding. There's no highmdoctor.com. We do not endorse or own that domain.
Is that even available? We need to get that.
I don't know, but I think I told you about this. I own drillme.com.
I
don't know where I'm going to redirect those leads, but I'll let your mind wander a little bit.
It's going to be like the next feet finder or something like that.
Exactly. Yeah. No, thank you. Well, we could use that. But yeah, no, honestly, awesome conversation. I thought it was so cool how much of a go-getter she was. Like, who submits something to the Globe and Mail? Like, that's big, right? Like, who just does that? Like, off the hop? Like, that's not
in
easy.
90 minutes. Like, I think, but do you think that she thinks about things differently than we do? As in, the things that we think are a big deal, to her, it's just like, meh, I'm going to try it. If it works, if it doesn't, whatever. And she just goes for it. Like, I think there's something to be said about that, is she's not afraid of failure at all either.
And I read that article just before hopping on the pod. And, what I noticed is she's a dentist. She's done so much in dental care and public health dentistry. She could have gone on and on about, advising Jagmeet Singh on the Canada dental benefit. Not once did she mention any of those accolades. She just talked about being an Indian woman in a, predominantly white environment. Like none of that was brought up.
Yeah, I noticed that too. Like, even under author, it was just Sanj Mohanta. It wasn't like Dr. Sanj Mohanta.
I didn't even notice that.
No, it doesn't even mention it at all. So I thought that was, for me, that gave a little bit more street credit for Sanj for me, because like a lot of us, I know I do, that dentist is my identity. Do you know what I mean? And
Yeah.
she was able to remove her dentist identity and write a badass article, get accepted, and it works for her. So that was pretty wicked, man.
And I actually got this from you. Like when we were in Montreal and you started your talk by just talking about all of your failures, and you didn't really stand behind the doctor or anything like that. I'm actually giving a talk soon to a dental club, and I'm in the process of formulating some slides, and I'm like, how when you talk to someone in academia or someone that's a big shot, their email signature or like their first slide is their name and then followed by 100 symbols which no one knows what they mean.
Totally. Yeah.
You know what I mean?
Totally.
So I did that. I said Akil Chawla, and then I put in all my major failures in like abbreviations and acronyms at the bottom.
That is hilarious, man. That is wicked.
And one, I want to see if anyone notices, but two, it's like, that's your badge of honor, not like you belong to some association that you paid $200 to get into. Like, that's your badge of honor, your failures.
Dude, can I use that? That's
yeah,
amazing.
do it. It's yours.
I can't wait to throw out my slide next time there's like 500 people in the room. First tooth ever took out in the sinus.
Yeah.
Period. Email me for questions.
As long as "Hi, I'm Doctor" does not appear in those sequence of letters, we're good.
Yeah, right. No, dude,
We're good.
that's a great idea, man. That's awesome. And I guess we can't be afraid of failure because that's what allows us to connect with each other, right?
Yeah. And I think
Yeah.
even looking at, Sandra's case, she probably had, like, we're here talking about how she got into the Globe and Mail, right? Which is huge.
Huge.
But
yeah,
we probably don't see the hundreds of attempts she said she was a horrible writer growing up. Like, we
Yeah.
probably didn't see those like hundreds of times where she put herself out there and just got like slapped, right? Like, went nowhere.
yeah.
So like, I think wearing those failures as a badge of honor, I think, is something that you clearly exemplify because of your talk in Montreal. I'm trying to do a little bit more. It's a little bit more unnerving when you haven't accomplished very much early in your career, right? To like wear all of your failures as a badge of honor, but that's vulnerability, right?
Yeah, man. No, man. What about going on stage and having a specialist come up after you telling you all your stuff is shit?
Did
That's
that
not
happen?
cool either. Oh yeah, man. I was sitting in the room and this guy's like, oh, that stuff, that's all fairy dust. None of that makes sense. And people are like behind me being like, what are you gonna say? What are you gonna say? And I'm like, nothing. I don't care. Like,
Wow.
yeah, man. It's you'll always get people with different opinions and people that think you may not have the experience, but dude, you're not talking to them. You're talking to the people that want to learn from you, and you're talking to yourself because at the end of the day, you just gotta have fun with it, man.
Did you start to sweat when you started to say that?
Hell no, man. I welcome that stuff. I welcome it when people put other people down. I don't know if he wasn't even at my lecture, so he wasn't doing it intentionally, but I got this question the other day, for going down these tangents. It's what do you do when specialists tell you that you shouldn't be doing something, or they criticize you for doing something? And this happened to another dentist, and she texted me, and I said, well, are you doing it properly and like to the like standard of care? And she said, yeah, of course, but I'm not a specialist. And she was like, I was like, yeah, no, I totally get that, but just remember, you're living in their head, they're not living in yours. And so if they feel like they need to reach out to you because someone feels threatened, or it just is a poor situation, and they feel like they need to reach out to you, they're obviously thinking a lot more about you than you are about them. So maybe you're doing something right.
Boom.
I don't know. Is that that's just me, man. That's my coping mechanism, right?
Yeah, you occupy now, space in their mind.
Totally.
They don't occupy any in yours, so
Yeah,
that's a win. But actually, some other cool news. I was in clinic today,
I thought you
and
were gonna say you're having a baby, man.
I
In
know I
other
haven't
cool
worked out in
news.
a while, but I told you about my chubby upbringing last week. No, so I was in clinic. I was in clinic today. We got on the podcast, and the first thing I said was like, I had an incredible day, right?
Yeah.
Which I almost never say, which I should be saying a little bit more. But I had an incredible day, but just ended there with that voice crack. And I had a faculty member come up to me today. And in dental school, you have to get your stuff approved, you have to get it swiped, you do a meta history check, you do a COVID screening, you have to get it all swiped. And this guy comes up to me and he goes, Akil, right? I'm like, yeah. He's like, dude, I love the podcast. And
Really?
I'm like, whoa, like, really? Like, are you gonna swipe my codes? But like,
Yeah.
more importantly, really? Like, you actually listen to my, like, dumbass? And I'm like, well, I got Neki on the podcast too, and like, and this guy knew you, and like through your like talks and stuff.
Oh, yeah.
I'm like, yeah, he's the like third molars online guy, but that was a little bit of juice this morning. That definitely
Really?
led to just some good feelings early in the morning.
Totally. And it's funny because that's like, we're not doing this for like people to listen to us. I'm genuinely doing this to talk to other dentists and to talk to you, because I feel like I'm on an island over here, man. And so I think it's wicked that we have an opportunity and a platform to talk to all the other to dentists across the country and across North America, as we'll have coming up here. But it's just fun. It's just so much fun to realize that we're all fighting the same battle, and we all struggle with the same problems. So it's it's cool to feel connected and united.
The totally selfish pursuit.
It is.
Please
it's more
do
for
not
me
listen.
than it is for you.
Please don't listen.
No.
No, but
thank you.
It's true. But thank you for listening. But
Yeah.
it's true. Like, I was actually just thinking about this on my walk today with my dog. I was like, the first time I actually felt like I could do anything was when I first launched the Majestic Mutt. Because I'm like, okay, I can now reach out to these people that have idolized for years and years and years. They're going to come on and talk to me. They're going to give me advice. I get their phone number. I get their email. I'm like, these people are human. Most importantly, I just realized that they're just normal people that either just had a good idea and executed against it, or they were lucky. But most of the time, it was that they had a good idea and they executed against it. And that's the only difference, between them and me. So why can't I do that? So that's another thing I learned from the first podcast.
Man. Yeah.
Yeah.
Dude, that is wicked. I just have to thank you, man. I'm having so much fun, and thanks for bringing me along for the ride, buddy.
No, man, you're just as valuable as to me as anything. So no, it's been a good journey. We're only a couple episodes in. We're just getting started. Yeah. So as long as we still keep having fun and enjoy speaking to people and enjoy talking to each other, I think we can't fail. There's no scenario that we can fail.
That's wicked, man.
All righty. Cool. So I hope you guys enjoyed the episode. We'll be back next week. We have some sweet interviews lined up. Thanks to Neki.
No, it's wicked, man.
All right.
I'm pumped. This is